Are you trying to conceive, but you're feeling overwhelmed by all the fertility ads promising miracle results? You are not alone. If you've been flooded with recommendations for pills, powders, superfoods, yet still haven't found a solution, this video is for you. Today I'm talking specifically about traditional Chinese medicine. We call it TCM, and I'm going to uncover why herbal medicines and fertility herbs, not supplements, may hold the key to realistic fertility, health improvement, and success in getting pregnant. Let's look at the science and wisdom and thousands of years behind TCM herbs, discuss the challenges with many supplements, and most importantly, show why addressing the root causes of fertility issues is non-negotiable to getting pregnant. With 27 plus years of experience as a doctor of traditional Chinese medicine, I'm also a master Chinese herbalist. I'm also going to share real stories from my clinic where countless women have switched from synthetic vitamins, generalized recommendations for vitamins, to herbal formulas, specifically personalized herbal formulas. And I'll show you how they've gotten pregnant. Hi, I'm Dr. Gina Terinoni, and I'm a board-certified doctor of acupuncture and Chinese medicine and certified women's healthcare practitioner in integrative medicine. I use 2,000-plus-year-old medical practices, and I combine that with the latest scientific research. In the past almost 25 years, I've helped over 2,000 women and couples over the age of 30 to become pregnant and have healthy babies. I would love to help you too. Do me a favor and subscribe to my channel and then click on the notifications because I put out weekly videos that come with action steps. I do all the work with the research and everything so you don't have to. To understand why traditional Chinese medicine or TCM works so well for fertility, we need to look at how it differs fundamentally from the supplement industry. Many supplements, especially those marketed for fertility, focus on isolated nutrients targeting symptoms rather than the root cause of infertility and fertility challenges. TCM, on the other hand, is all about balance and healing the body from the inside out, the main focus always being to get to the root cause of the health problem. We have to do this by doing a full medical evaluation and review of a woman and a man's health systems. In Chinese medicine, fertility isn't treated in isolation. We focus on underlying imbalances that may be affecting reproductive health, such as liver qi stagnation, kidney yang deficiency, and blood deficiency. When we address these root causes, this supports not just fertility, but the entire body's health system. For example, one common cause of fertility issues is liver qi stagnation. I see this all the time with my local patients in my clinic. This can be triggered by stress, poor diet, or lifestyle factors. The stagnation impacts the reproductive organs and it disrupts the flow of blood and oxygen. This makes conception much more difficult. I once treated a patient who had experienced multiple miscarriages, and she was feeling completely hopeless when she reached out to me. Traditional Western treatments weren't working for her. They kept putting her on very strong medications and were completely taxing her body. She didn't even recover for these miscarriages when they were already putting her on more medications. When she came to me, she was referred by her IVF doctor, and we focused on nourishing her blood and supporting her liver with traditional Chinese medicine herbs. We also helped heal her from her previous miscarriages. Over time, she regained hormonal balance, her cycles became more regular, and she was able to carry a pregnancy to term. This is the power of addressing root causes rather than symptoms. And when medical practice treats symptom only, they are band-aiding the surface and not addressing the root cause of the problem. That can cause problems when a woman does get pregnant. That same health issue will keep creating these issues over and over again like a broken record. Let's talk about bioavailability. This is a critical aspect often overlooked in the supplement industry. Bioavailability refers to how well our bodies can absorb and utilize a nutrient. Many supplements, especially synthetic vitamins, aren't easily absorbed, often leading to side effects. Synthetic vitamins like folic acid and vitamin D are often poorly absorbed, especially in isolated high doses. Many women will experience nausea, bloating, even GI distress, because these supplements lack the natural complexity of whole foods and herbs or herbal medicine. In contrast, TCM herbs are much closer to food. They are minimally processed and retain their full spectrum of bioactive compounds, making them more easily digestible and way more effective for the body to absorb and to heal. Herbs, such as the herbs that are in Shayos, which includes bupe for liver health and white peony for nourishing the blood, are not only safer but also provide multiple benefits. Beyond fertility alone, these herbs work in synergy, supporting the body in a way that synthetic vitamins often cannot touch. They're simply not made to do that. Let's look at some specific herbs commonly used in TCM fertility formulas. These herbs are well documented for their benefits both in TCM theory and in scientific research. I'm going over these herbs to help you understand the power they can produce, but I am not saying these are fit for all women trying to conceive. Your best bet is by working with a doctor in traditional Chinese medicine like myself, and make sure that if you're working with me or someone else, that they are a master in traditional Chinese herbal medicine. I offer a personalized herbal medicine program for women trying to get pregnant, where we review your medical history, we look at diagnoses, we look at what have you tried so far. I take into consideration many details of your menstrual history. This is very important. I also look at diet and I look at absorption, and we check in monthly and we make herbal updates. Updating herbs and dosage is very important because we are dynamic human beings. We're never in the same state. We need to make these monthly adjustments. You will be improving every month, therefore requiring these personalized adjustments. This is really important to note, that you can create harm if you get one formula and you say, I'm just going to do this until I get pregnant without checking in with a doctor or an herbalist, a master herbalist. Comment herbs below and I can send you the link so you can learn more about my herbal program and what that looks like to work with me in that program, or check the show notes for it. I had mentioned bupleurum, which is called chaihu in Chinese. And bupleurum is a key herb in Shaoyusan known for its ability to release liver qi stagnation. When stress or emotional strain affect the liver, it can block the body's natural energy flow, leading to menstrual irregularities and even infertility. Bupleurum helps clear that stagnation out, and it can help restore balance to the reproductive system. But why wouldn't we just send everybody to this herb? Is because some women take that herb and they can get really bad headaches. So we have to screen for things like this. And next up is white peony or baishao. Peony is a wonderful blood-nourishing herb, essential for women experiencing symptoms of blood deficiency. So that would look like light periods or irregular periods, or really spotty. By nourishing and harmonizing the blood, white peony improves both fertility and menstrual health. Angelica, known as the female ginseng, Dang Gui is a foundational herb in TCM for fertility and women's health. It promotes healthy circulation and supports the uterus, making it valuable for women with fertility issues. It often is included in formulas to improve blood flow and circulation, and it can be very helpful to regulate an irregular menstrual cycle. Cascada or Tusutsa is often used in TCM to nourish the kidneys and support the endocrine system. This helps to regulate hormone levels naturally, improving ovarian function. This herb can also help prepare the body for conception. Atractylodes or baiju helps support digestion and immunity, two areas often overlooked in fertility. By strengthening the digestive system, Baiju ensures that the body can properly absorb nutrients, and this will help to create a strong foundation for a woman to be able to get pregnant. Let's look at some misconceptions and red flags with supplements. A big reason why women are hesitant to try herbs is the heavy marketing of supplements, which often creates misconceptions. Many women think more supplements means better results. However, I often see patients bringing bags of supplements to their appointments, confused, and why am I feeling nauseous, feel so sick, or I feel bloated, taking the vitamins even with food. They're unaware that taking too many supplements, especially poor quality fertility supplements, can do way more harm than good. And another thing is there's lack of regulation. Unlike herbs from reputable practitioners, the supplement industry lacks strict regulation. This means that many products may contain fillers and additives that reduce their effectiveness and can even cause digestive issues, which will impact the absorption of nutrients in the body. One patient came to me with severe digestive problems and fatigue. She was taking multiple supplements, but none were improving her health. She kept taking them because she read about them and saw that other people were taking these to get pregnant. When we switched her to a TCM herbal formula targeting her specific needs, her symptoms gradually improved. Her fertility journey became much smoother. In fact, she stopped taking all the supplements altogether and she was able to conceive and have a beautiful and healthy baby within about 5 to 6 months of doing the switch. Let's look at how to choose high-quality products. Look for supplements that are third-party tested and free from unnecessary fillers. Ingredients should be simple and directly aligned with your needs. With herbs, your best bet is to work with an experienced TCM practitioner who sources their herbs from reputable suppliers. This is especially important because TCM herbs are highly specific and need professional guidance for safety and efficacy. Have you tried supplements or herbs in your fertility journey? What was your experience? Share in the comments and feel free to ask me questions about TCM, Chinese medicine, and fertility. I'm here to help you.